Hello everyone, it's Dr. Ahmed Rehan Khan from Virginia, USA here. Today I have a very special guest, someone I have admired a lot, and someone which I think that in addition to being a psychologist, PhD psychologist, what he has been doing, which in my opinion is fighting misinformation and fighting what we call, I mean, don't want to use that word, but what we call the antipsych uh, the movement, and he is active on various social media platforms, especially X, formerly known as Twitter. I have been reading his uh, posts about it, and it just like I wanted to reach out to him because all of his posts, the way he writes, the content he writes, it just touched me. That because I'm originally from Pakistan, there's a sheer lack of mental health awareness in that part of the world, and I have been trying to fight the same fight there. But here in US, I think it's an altogether a different beast because here it's not that they don't understand it. I think they do understand it somewhat, but then they come out with a lot of things, which, I mean, some of their concerns, of course, could be legit, but then the shared misinformation can be very painful for me as a psychiatrist. So without further ado, I would request Dr. Stea to tell us a little bit about his journey and how he started all this movement. I would say it's a moment.
Yes, thanks, Dr. Khan. It's my pleasure to be here. I think you're doing a fantastic battle in this fight for misinformation as well, trying to debunk it. And because it's really important, it affects everyone's lives. It can affect people's health decision making. So that's why we're doing it. And I consider it an ethical duty of psychologists, which I am, and psychiatrists as well. So yeah, thank you for that intro. I'm a clinical psychologist, so my day job is working in a hospital setting, and I work on a great, what we call multidisciplinary team with other psychiatrists and other psychologists and social workers and nurses. And we help people that have what is called concurrent addiction and psychiatric disorders. So they have both addiction and mental disorders. And we work on a team where we do individual therapy and group therapy and medication management and case management. So that's my kind of day job. And I get to supervise students and residents and things like that, which is really great. I have an academic appointment at the University of Calgary as an adjunct assistant professor. And then, like you mentioned, sort of at the side of my desk is a passion project of really taking to science communication, where we are sort of at the forefront of trying to help battle mental health misinformation and mental health pseudoscience. What got me into that was I've been doing this for about 5 years online on social media. Um, and I've learned a ton along the way. And it just so happened that after, 5 years of people kind of emailing me things like, questions, Jonathan, is this article legitimate? Is this guy a quack? Is this treatment a scam? I decided that I really wanted to help empower and embolden people to take their mental health into their own hands to try to answer those questions for themselves. And so that was the impetus for me writing a book called Mind the Science. And so that's what I'm trying to do. So I appreciate that we have a great science communication community like you, that we're all kind of on the same team here trying to help battle this stuff.
Absolutely, absolutely. And I would recommend all of the people who are watching this video to buy the book and read it, whether you would agree what's written in it or not, but it's a perspective. And I think that's the most important thing in any scientific argument is uh, accepting others' perspective as an opinion, and then you can, if you don't agree with it, then you can have a counter opinion. What personally I have seen in all those Dr. Steer's posts and all that, that a lot of people, what some of, not a lot, some of people, what they do is they don't have any legit argument to what he's saying. What they do is they just like start to do the below the belt attacks and stuff like that because maybe only a handful of people that actually have a counter argument, which I personally believe that psychiatry, field of mental health psychology, we all know that the history has some dark passages. That, of course, it all when it started back in the day, uh, there were instances at some hospitals where it's possible that those things happen, uh, and I feel that it's with every field of medicine. What I find it hard to digest or believe that people just target this specific mental health field. And what I feel, and of course will have Dr. Stea's opinion as well, that it's the lack of objective measures. So for blood pressure, they can easily measure it. For fever, temperature, they can measure it. You give the medicine, it goes down, they can measure it. For diabetes, they can measure the blood glucose level. Similarly with heart problems. So I think, of course, with the psychiatric illnesses, the depression, anxiety, it's mostly the subjectively what patient is saying. I mean, there are functional MRIs. If you do, you could actually see the neurotransmitter imbalance and all that. But but that's of course not very commonly done. So I think I feel that one of the bases is that lack of objective measures that basically starts that discussion, and then uh, from there people take on, and then they start talking about medications and all that. So Dr. Stea, what's your opinion about how the field of mental health has evolved over the years?
Yeah, I agree with you. And we see it in psychiatry and in the field of mental health. We also see it just more generally with chronic and complex health conditions that we don't understand. And so basically we have gaps in our knowledge with respect to the nature of psychopathology or the nature of mental illness and just a lot of health conditions. And that's a reality. We don't know everything about health conditions. We don't know everything about how to treat them. And so that's what science is for. Science is a pursuit of truth, and it's trying to get closer to that truth so that we can better understand health conditions and how to treat them. What we see in the misinformation space, particularly in the wellness industry and the anti-psychiatry movement, which I'll kind of comment on, is that, like you mentioned, we get these oversimplified ideas and this misinformation spread and this propaganda spread that, from their perspective, they try to sow distrust in mainstream healthcare, and they just propagate these old, easily debunked, repeated ideas, what we call tropes. They're the repeated ideas and themes. So things like mental illness doesn't exist at all, or that all psychiatric medications are more harmful than helpful. I mean, these are really easily debunked ideas,
Mhm.
but nevertheless, on social media and in other kind of spaces, you see that they're propagated. And the point of that is to really sow distrust in mainstream healthcare. And it's really bad. It's a really bad thing. Like you mentioned, though, and I'll use the word anti-psychiatry movement because that is where it started. It started at least in the 1960s,
Mhm.
and it had a good purpose. The purpose was, as you mentioned, psychiatry had a dark past. It
Mhm.
had various missteps, like the inhumane treatment of patients in asylum care,
Mhm.
and inappropriate pathologizing of minority groups,
Mhm.
and this kind of perceived arbitrariness of diagnosis, because again, we don't fully understand mental illness. And so there was a lot of reaction against that at that time. There was leaders in the anti-psychiatry movement like Thomas Sass.
Mhm.
David Cooper coined the term anti-psychiatry in 1967. And these guys were really pushing back against that idea, trying to make psychiatry more scientific and more humane. The good news is that it worked. Psychiatry got its act together. And
Mhm.
then by the 1980s or so, we saw a lot of those benefits, because a lot of the care was moved from asylums into the community. The psychiatry it really adopted the scientific spirit and adopted what we call a biopsychosocial model,
Exactly.
meaning it pays attention to the biological factors, psychological factors, and social factors that help explain mental illness and its treatment. And so by that time, the anti-psychiatry movement greatly diminished in the 1980s, but it didn't die. Now we see that it's sort of transformed, and it's turned into a movement that has outlived its cause, and it's
Mhm.
harmful on social media. And like you said, what we see is now there's just a lot of it's personal attacks, or
Mhm.
it's the spread of propaganda in sources that are outside of mainstream science and outside of mainstream healthcare. So they're perpetuated in books or in blogs or on websites like Mad America that are devoted to flaming psychiatry in a way that
Mhm.
dodges scientific critique.
No, absolutely, and I really like that point, and I have seen you have mentioned in your post that it's so some of these things are connected. So starts with the like a wellness industry, so the naturalistic treatments, and then they talk about herbs that are not regulated, and then the same people uh, are uh, are blaming psychiatrists for every problem in the world, and then the same people are also anti-vaccine. So there is a connection, and the same people are spreading, okay, that vaccine caused autism, that caused this. So I think it's a pattern that anti-psychiatry movement has been hijacked by people who had like anti-science beliefs, and they felt that because psychiatry, for the lack of like objective measures, it's an easy target as compared to if you start movement again gastroenterology or cardiology, where of course people have more like objective measures. So I absolutely agree that this concept of, and I mean, I won't again don't want to say holistic medicine, because holistic medicine has good aspects as well. But again, some people I have also seen using holistic medicine, the naturalistic. These are like some of the fancy words I have seen people using. And when you dig deep into what they have been doing, it's more or less the same things.
Yes, exactly. There's a crude term. It was coined by Mark Hoofnagel, who's a physician, but it's called crank magnetism. And it's this idea that different pseudosciences or different conspiracies, like a magnet, they kind of attract each other. And the reason for that, like you said, is that underneath this is a similar thread of anti-scientific or pseudoscientific belief systems. And it's sort of a marriage to this kind of ideology. And like you mentioned, we can use the term holistic medicine. What I do in the book is I call it alternative medicine, and the reason for that is because alternative medicine has a history. It was first used in the 1970s. Before that, it was fringe medicine or holistic medicine. But one of the arguments that I really try to put forth in the book and that I try to make clear on social media is that alternative medicine is not just a set of unsupported treatments or pseudoscientific practices, because as you said, once certain treatments that are quote unquote holistic or natural or whatever kind of words you want to use, once they reach enough evidence, they then cross a threshold and become part of evidence-based care. And
Exactly.
so, rather, alternative medicine is not just a set of unsupported treatments, it's an entire narrative, it's an ideology, and it has its own tropes and its own themes and propaganda tactics to sow distrust in mainstream medicine. And people can see this with their own eyes when they Google like a local alternative medicine clinic, and they'll see, again, like you mentioned, a lot of the same, there'll be alternative medicine tropes, but there'll also be kind of anti-psychiatry tropes if you're looking for things that, alternative medicine clinics that purport to treat mental health concerns. And that stuff it's very dangerous and it's antithetical to good patient care.
Yeah, absolutely. And especially what I've seen even in US, but more so in Pakistan and India, there is a very concerning trend that a lot of people that are on mainstream media or social media that are talking about, let's say, parenting or a hypnotherapist and addiction therapist. Unfortunately, a lot of those folks, they don't have any formal degree. They may have done like a certification, and they have like 100K followers, and they are like spreading misinformation left and right. And that's especially in Pakistan and India. And it's so concerning because some of the videos people share it with me, I hear, I listen, and I was like, oh no, that's not how things are done. And then of course they have a huge following, and then it's just like when you spread misinformation, you spread it to enough people, it kind of becomes like a truth, at least among that certain group of people, and that is something that I have found very concerning.
Exactly. As we've talked about, there's a name for that too. It's a psychological phenomenon called the illusory truth effect. It derives from the work of Daniel Kahneman, who was a Nobel Prize recipient in economics. And basically, the illusory truth effect means that our brains aren't really good at differentiating familiarity with the truth. So the more times we hear misinformation and we see misinformation, the more likely our brains are to believe it. That's just the way it's wired, and that's why it can be dangerous.
Absolutely, absolutely. So I would just ask you quick three, four questions that I get a lot and a lot of people ask me, and I would request your perspective on it. So when people say that the mental health illnesses it's they do not exist because they are just natural responses to stressful stimuli, or every mental health illness, including schizophrenia or the most severest of ones, are just trauma responsive. So what's your take on
Wow, I think it's absurd. But I mean it's an anti-psychiatry trope, right? To get technical, what that response is doing is what we call psychosocial reductionism. So it's reducing the complexity of mental disorders or mental illness to just the social factors like trauma. And sure, trauma, it can be involved in a lot of mental disorders, but it's not the single cause for all things. And so back to our biopsychosocial model, we know that mental
it?
disorders and mental illnesses are an interplay, and we can understand them at different levels of analysis, the biological, the psychological, and the social, and that's what they become. And so I think like we said, what anti-psychiatry propaganda does is it preys upon a kernel of truth. And the kernel of truth is, like I mentioned, we don't fully understand the nature of mental disorders and mental illness. That's why our diagnostic systems evolve over time, like the DSM, the Diagnostic and Statistical Manual of Mental Disorders, which has transformed from the DSM-1 to the DSM-5 text revision, which we are now. And we've seen the number of mental disorders kind of expand during that time. The reason for that is we're not terribly good at carving nature at its joint, so to speak.
Exactly.
Um, and at the same time, it's the DSM is like it's a terrible map, but it's better than no map at all. And so
Exactly.
Alan Francis was one of the chairs of the
Yeah.
DSM-4. He's a psychiatrist, and I love what he says because he said something along the lines of I equally distrust people who worship the DSM than who ignore it completely.
Exactly. No, I have seen his posts as well. Yeah, exactly.
So that's the message is that so we don't fully understand it, but that doesn't mean that schizophrenia and bipolar disorder don't exist. I mean, we see these things and we see them with our clinical eyes. We have scientific evidence to back that up. Sure, we may debate about the particular criterions and the
Mhm.
clusters of symptoms that reliably cluster together to
Mhm.
define these things. Um, and maybe some mental disorders will have more scientific validity behind them than others. But
Exactly.
again, that's what psychiatry is.
Mhm.
It's necessarily a scientific discipline, and that's the beauty of it. You mentioned that it's great to critique this stuff, and that's what science does. It critiques itself. That's what the
Exactly.
discipline of psychiatry does. These arguments are fought in the scientific journals every single day by people devoting their careers to it. What the anti-psychiatry movement does is it fights those debates outside of the scientific journals
Yes.
and it presents its propaganda and opinions in a way that ignores mainstream science.
Yeah, absolutely. And can't agree more. And a lot of time, what I tell people that if in a clinical setting, you actually see a psychotic, clearly psychotic or manic patient, you would never say that they don't exist. If you actually see those people in your clinical practice, because the thing is so obvious. The other thing, so a lot of, again, the one of the other biggest thing is the PSSD movement, or like when they say that all psych medications, especially the SSRIs, like they have caused irreparable neurocognitive damage, irreparable, like irreversible sexual damage, and they just don't do anything at all. So what's your take on these claims?
Well, we need accurate risks and benefits during the informed consent process. Again, we're actively learning about the nature of those risks and benefits. That's what science is for. Um, we do know it exists. I think it's very rare and um, it's much more rare than the people that we see attacking us on social media would lead people to believe. That's
Mhm.
not to say that I mean, I fully support research into this, Deborah. I fully
Absolutely.
support investigating it because our patients deserve the best.
Mhm.
What we see instead, though, in these online spaces is the spread of misinformation and propaganda related to it, with the point of fear mongering and treatment deterring and essentially stigmatizing psychiatric medications and the people that benefit from them. And so the online space can become a breeding ground of misinformation and hate and targeting. And that I think is extremely unhelpful. Yes, treat, like even like vaccines. Vaccines can have risks. So can psychiatric medications. We know that. We need to better understand it, and we need to do that in the service of our patients. That's not a green light to fear monger and spread misinformation about it when you simply don't have that information.
And absolutely, I mean, my 4 year of residency, 3 year post residency. So for the past 7 years in US, I have been like treating people with antidepressants, and I have like forget about all the research, forget about everything. What I have personally seen people getting benefits. And yes, at times when I started, I always talk about benefits versus risks. And if they agree, we start, and sometimes they would have side effects, will discontinue or will like change it. But I have seldom seen people where they would say that it has like permanently damaged my sexual health or the neurocognitive status and all that. And again, that's where I feel that all of those people behind these propagandas, they have actually not done that themselves. Like they have not prescribed people, or they have may not have even have first-hand information. It's more like hearsay. That person told me, and that person told me, and creating. I agree that hate-mongering atmosphere, making people fearful actually to reach out for to get psychiatric treatment, which is concerning.
Yeah, I agree. The stories matter, the research matters, the science matters. What is unhelpful is the fear mongering, the overgeneralizations, the spread of just flatly false information about psychiatric medications and about the nature of mental disorders themselves. And that's the reality of what we see. It's incredibly targeting, and that's why the online space is, I think, very unhelpful for a lot of people because number one, patients can feel like their lived experiences are invalidated.
Mhm,
Mental health professionals can
mhm.
feel attacked, and lost in that space is just, again, the science, and it's a breeding ground of misinformation and hate. And that's not in my experience, it's not the avenue to do it. It becomes a very polarizing, divisive area. And at the end of the day, I think it gives breadth to anti-psychiatry propaganda, which stigmatizes people and deters treatment seeking. And to me, that's a threat to public health and patient care.
Absolutely. And one thing which I have noticed, I started noticing that almost a year ago, and then I saw Dr. Annie Hickok's post as well, that British, I think it's the British Psychological Society. So I fail to understand that it's like a formal psychological association of a huge country that is big on science. But some of their comments from the people that have been or even current office holders, I was stunned, and then I reached out to some people, and they told me that yeah, that psychological society has been has been hijacked by some people with those beliefs. And that's where when I started following you, I really liked it because you being a psychologist, the way you explain things, because if a psychiatrist is saying that, they will start blaming, oh, he's just a pill prescribing machine and all that. So tell me a little bit about if you have had any experiences uh, interacting with those people from the British Psychological Society or Association.
Well, I'll speak more generally about it because, yeah, I'm in Canada, but I am familiar with what you're speaking about. But yeah, I think it speaks to the idea how science and professional organizations can become politicized.
Mhm.
Um, we one spoke on the wheel, so to speak, of the anti-psychiatry movement are fringe scholars and kind of self-identified psychologists and disgruntled psychiatrists who do kind of spread this kind of
Mhm.
misinformation, but they are on the fringe. And I think that and the reason they're on the fringe is because their views don't align with the scientific research and consensus of most professional bodies, and most professional and clinical practice guidelines. And I think what has informed my view on these topics is, like I've said, I'm a full-time clinical psychologist working in a hospital setting. I've been doing that for over a decade, and I work alongside addiction medicine physicians and psychiatrists. I've been doing that every day for over 10 years. And so I see what they do. I see psychiatrists shouting skills over pills and safely prescribing and safely de-prescribing
Mm,
and working from a biopsychosocial model. And so and I think in the real world, so to speak, psychologists and psychiatrists have fantastic working relationships,
oh,
and we do
absolutely.
that in the service of our patients. It's
Absolutely.
really sad and unfortunate that some pockets of the world can become so wrapped up in this in anti-psychiatry ideology.
Okay. So my second last question is, do you feel that most of these people that are in the forefront of anti-psychiatry movement, do you feel that they know what's truth and they still spread it just maybe to gain a cult following or all that? Or do you feel that most of them actually believe what they're spreading?
Well, and it's a great question, and it kind of extends to kind of the wellness world more generally, and alternative medicine influencers and Instagram influencers. Certainly I think people can make a brand out of it and a profit, and they can, again, sell books, workshops, um, treatment manuals I've seen trying to revise entire diagnostic systems, so they can make a career out of anti-psychiatry ideology. Um, I would, I mean, the optimistic part of me likes to believe that most of these folks aren't malicious and most of them aren't trying to deceive patients and spread this kind of propaganda. At the same time, that also, in some ways, that makes it worse because I think the reality is that most of these folks do actually believe in their own bullshit, so to speak. And I think that's a very dangerous thing because when you get people believing in the propaganda and misinformation that they're spreading, they become much more passionate about it. And I think that's what we're seeing. And I think that's the case in the wellness industry at large. I think a lot of these people at the end of the day, we're all human. I think they are caring people and they do want to make a living. I think they're just grossly misinformed and they're married to pseudoscientific narratives and ideology.
Absolutely. My last question is, recently there were some folks on the internet, they were raising this question that is psychiatry a branch of medicine?
I saw that. Yes, it's absolutely a branch of medicine. And again, I think that speaks to that anti-psychiatry narrative. It's that view that wants to tear down the discipline of psychiatry, take it away from the field of medicine. Again, psychiatry is a science, and it's predicated or based on a biopsychosocial model. It's not and that's the case of all medicine. All medicine
Mm,
takes into account biology, but we also have cancer units and burn units and, cardiology units that also have psychologists on board and social
absolutely,
workers
absolutely.
that
Yeah.
take into psychological variables and social variables. And so psychiatry, like those other branches of medicine, is rightfully a branch of medicine.
Absolutely. What would be your concluding message to everyone who is listening? I mean, who will actually listen to this video? How how can they answer these misinformations if they encounter one?
It's a good question. My message would be to be skeptical, not cynical, but be skeptical of the sources that you're seeing out there. Check in with colleagues and try to, one thing that I try to do in my book is to teach the language of pseudoscience so that we know when it's spoken and to learn the language of anti-psychiatry and to learn the language of alternative medicine ideology. And I think when people can learn that language, they're better prepared to um, siphon the truth from the mistruths, so to speak.
Absolutely. Well, thanks a lot, Dr. Stea. It was wonderful visiting with you. Hopefully, in future, we can do more of these.
I'd love to. It's my pleasure. Thanks, Dr. Khan.
Thank you.